Welcome back to the Made to Mom podcast. I'm your host, Dr. Alexia Priolo, naturopathic doctor. And on today's episode, I'll be discussing gestational diabetes. Now, this is another one of those topics like preeclampsia where I'll often see in like Facebook groups, should I do the gestational diabetes test? Are there any alternatives? Now, I'll see topics like these come up around why the screening is recommended. And I think it's often because there really isn't any education about like what the screening does. And so people are often turning to community groups or chat GPT for this information. So I think it's really important for us to dive into this topic by looking at the research so it can help you make your decision to screen for gestational diabetes during pregnancy. Now, gestational diabetes mellitus, and I'll be referring it to GDM from here on out, is one of the most common pregnancy complications worldwide. The prevalence of GDM varies widely depending on the population, screening, and diagnostic criteria. And in Canada, we see that it affects about 10% of pregnancies. Now, a diagnosis of gestational diabetes doesn't discriminate. Literally, gestational diabetes can happen to everyone, no matter how healthy you might be, how well you eat, etc., etc. In pregnancy, the body becomes a bit more sensitive to insulin, helping store extra glucose as fat to prepare for later trimesters and potentially nursing. Now, as pregnancy continues, maternal and placental hormones make the body more resistant to insulin. Now, if the body can produce enough insulin, blood sugar stays normal, but if it can't, blood sugar levels rise, leading to glucose intolerance or gestational diabetes. Now, there are some risk factors that are strongly associated with gestational diabetes, and the strongest predictors are a previous diagnosis of gestational diabetes and a first degree relative with type 2 diabetes. Other strong predictors include a person's ethnicity, an age over 35 years old, and a BMI of over 30. Factors that are associated with a lower incidence or a lower risk of just developing gestational diabetes are age, so younger than 25 and 30 years old, white race, BMI of less than 25, no family history of gestational, or sorry, no family history of diabetes, and no history of glucose intolerance or adverse pregnancy outcomes related to gestational diabetes. In Canada, screening for gestational diabetes typically happens between 24 to 28 weeks, although in some cases it might occur earlier. Now, screening is really important because routine screening isn't widely performed in people who are of reproductive age but aren't pregnant. In fact, many cases of gestational diabetes represent pre existing hyperglycemia or increased blood sugar, which is often detected by routine screening in pregnancy. Now, universal first screening for gestational diabetes is recommended to prevent macrosomia, which is a large baby, and reduce the risk of complications like shoulder dystocia, birth trauma, and neonatal low blood sugar. Most importantly, it reduces the risk of fetal death. For the pregnant person, it can reduce the risk of developing preeclampsia as well as a C section birth. In Canada, a two-step approach is most frequently used to screen for gestational diabetes. The first step is a 50-gram glucose challenge. This is when a 50-gram glucose drink is consumed in under 10 minutes and serum glucose levels are measured 1 hour later. Three situations might happen after this challenge. The best situation is that the person will pass the test and not be diagnosed with GDM. The second is the person fails the test, but their serum glucose falls within a range that results in the second step of the screening. And I'll talk about that in the second. And the third situation is when the person fails and their serum glucose level is higher than the ideal threshold, and so they're diagnosed with gestational diabetes. So let's rewind to that second situation. After about 2 weeks, when dietary and lifestyle approaches have been implemented, this person who has failed the oral glucose challenge test will proceed to the next step known as the oral glucose tolerance test. This particular test is the diagnostic test, which involves drinking a 75 grams bolus of sugar, and their fasting serum glucose is tested at baseline. So before they consume the drink, 1 hour after having the drink, and then 2 hours after having the drink. And at this point, the person will either pass the test and not be diagnosed with gestational diabetes, or fail the test and then be diagnosed with gestational diabetes. Now, if they are diagnosed with gestational diabetes, they might be recommended dietary and lifestyle techniques to help manage it for the remainder of the pregnancy, or they're offered medication like insulin to help maintain their blood sugar levels. Now, in some mom groups, people are asking, like, what about alternative tests? Like, what can we do instead of this orange drink? Several studies have found that eating a specific number of jelly beans, usually around 28 to provide 50 grams of sugar, gives the same blood sugar results as drinking the orange drink for gestational diabetes. People in these studies had fewer side effects like nausea or bloating, and most said that they preferred the jelly beans. Other candies, such as like Candy Twist, show similar results. That said, major health organizations such as the American Diabetes Association still recommend the traditional glucose drink, mostly because it's been tested and standardized, while the candy options can vary in sugar content. Being someone who's both had the sugar or the orange drink, that's like the 50-gram drink, and had braces for 4 years, I would not to love to have that much candy in my teeth, but honestly, that's just me. The fresh test is another alternative that often comes up because it's claimed to not contain any additives, no artificial colors or flavors, etc. I do want to mention that the testing that they did was on 10 non-pregnant, non-diabetic subjects, and in that study there weren't any differences in plasma samples, and everyone did prefer that beverage compared to the traditional one. Now, this test does need to be ordered and paid for by patients, whereas the traditional drink is free in Ontario, or at least covered by our provincial health association. Lastly, hemoglobin A1C can is also mentioned as an alternative. This particular test measures the average blood sugar over the past few months, like a 90-day period, and it cannot replace the standard oral glucose tolerance test for diagnosis. And this is because pregnancy naturally changes how red blood cells and sugars behave, making hemoglobin A1C results less reliable during this time. That said, hemoglobin A1C can be helpful as an early screening tool when used alongside some of the risk factors like age, body mass index, or BMI, or family history. Even if a hemoglobin A1C is suggested of someone being at risk for gestational diabetes, a, a oral glucose tolerance test is still needed to make that diagnosis. So for now, the oral glucose tolerance test remains the gold standard for screening and diagnosing gestational diabetes. Now, thank you so much for listening to this episode about gestational diabetes. I hope you found it informative. If you've been pregnant, tell me, what did you think of the orange drink? There are some labs which do have a white drink. So, this, I believe, it doesn't have the color, and I believe it might be unflavored, but I don't know for certain. I had the traditional orange drink. But if you had it, or even the clear one, let us know in the comments what you thought about it. I've had some pregnant patients not really mind it at all. And to be honest, I'm recording this during holiday season right now. Holiday drinks are all the rage. And I don't know about you, but I could drink, a holiday coffee in under 10 minutes too. And so I think it's just important to recognize that, if there's some times where you like indulge in these sugar sweetened beverages, taking this test once or one time every couple of years until, you choose not to be pregnant anymore may not be, you know, might be tolerable, to be honest. Anyways, if you found this episode helpful, please subscribe to the podcast, leave a review, or follow me on social media. I'll talk to you next time. Take care.